Hi, my name is Brian. This is Tough Talk, and I have a lot to talk about. Today's topic is medication. Um, so it occurred to me that one of the most important things that I could talk about right off the bat would be medication and what it's like to be having bipolar and go through all of the hardship that surrounds medication. Um, so first of all, I'll talk about my experience with lithium for the first time, and just go from there in chronological order. So about 3 years ago, I got the diagnosis. I was in the hospital, and they gave me lithium for the first time, and my initial response to it was very positive. Like, I was really suffering with a manic episode, and it was causing me a lot of pain, and to have the lithium introduced about 6 hours later, I started feeling a bit more cool. Just like I was originally like so hyped up on adrenaline and anxiety that to get lithium was just calming me down, and so I really liked it, and that continued for about a month, and but after that I started getting some of the side effects, and the most common side effects of taking lithium would be gastrointestinal distress. So it really upsets your stomach. You've got this salt that is a metallic salt that just gets into your body, and it's not normally there, and your body just doesn't have any adaptations to it. So it feels very discomforting, and not to mention it has a huge sedative effect. So the sedative effect on my system basically put my gut to sleep. And so for the last 3 years, I've been fighting off and on just occasional diarrhea, just out of the blue, for no apparent reason, for no, like, I didn't have any lactose. I've given up all dairy, well, except for cheese. Cheese I can handle, but anything else like is terrible. Like, I can't tolerate it. So I've given up just about everything that you could think of that would cause any irregularity, but at the root of it, lithium is the cause. And so it actually wasn't until recently that I figured out a solution, and so I'll talk about that in a bit. But so I started having a few problems, about a month in. And my first psychiatrist, who treated me after I got the diagnosis, he started brainstorming alternatives. So he was very kind, very caring, really listened to me, and he really took the time to even respond, and not many psychiatrists do. He responded to me emotionally, and he helped encourage me and do a bunch of things that I really appreciate to this day. But he started looking for alternatives, and some of the alternatives are, one of them, a big one, is Lamictal, and I know several people with bipolar that I've talked to since that are currently getting managed by Lamictal instead of lithium, so that is an alternative. So I tried that, but to a greater degree than the lithium, Lamictal did cause me to have constant diarrhea, which was pretty terrible. So that was a constant thing, every day. It was, several times a day. It was very disruptive, and I thought, no way, I have to stop taking this. And he did give me certain permissions for when I should stop taking it. One of them is if you get a rash, with Lamictal. Strangest thing about that medication is if you get a rash, it suppresses your ability to fight that rash, and so it could cover your whole body, and it's a very rare condition, but it's just funny that that condition exists. So that's just to put into perspective some of the insane side effects that go along with these medications. like these medications are by no means refined in any sense of safety or any sense of everyday. Like it's nothing like Tylenol. These are serious things. So, I had that experience, and I tried a couple other medications. I don't know if Latuda is also a mood stabilizer, but I do know that it is also a bipolar antidepressant, and so I've been on that. Latuda gave me restless leg syndrome, which I couldn't sleep at night because my legs were constantly moving. So all in all, there were a lot of drawbacks, and it was kind of shocking to me. I was starting to wake up to like, hey, people with bipolar, they do not have it easy. There is a lot that you have to deal with, a lot that you have to learn, and a lot that you have to put up with if you're going to try and get help. But my story with lithium continues. I was going pretty steady on a healthy dosage for another year, and I go through another psychiatrist, and then I'm finally with the one that I'm currently at. So this is my third psychiatrist, and so fortunately she is as good as my first, and so I was going pretty strong, and then one day, like on a Thursday, I went to the gym. I came back. Well, I didn't come back, but I went after the gym to my therapist, and I meet with my therapist once a week, and so I met with him, and he goes after I've talked for a bit. He goes, Brian, you seem really excitable. You seem to be talking faster than normal. You seem to be talking, jumping from subject to subject. And he asked me, "Are you all right? Are you on your medicine? Is your medicine at the right dosage?" And I go, "No, I don't feel all right. I feel like I'm way more excitable than I can control. Like there's this level that I'm aware of, but my excitability surpasses that level to a degree that is frightening to me." And so yeah, I became aware of that immediately, and I went home, and after much deliberation I decided I needed to take another pill, and I did. And then I went in to get my blood tested the next day, which is what you do if you notice any severe irregularity in your behavior, and if your bipolar symptoms come up, you need to get tested with a blood test as soon as possible, because that's data that your psychiatrist will see and appreciate, and it'll help you manage your dosage that much more refined. And the more refined you can manage your dosage, the better. The less overall medication you'll have to take, and the less side effects that you'll get from that medication. So that aside, so I got tested, and it was low. It was at 0.6. But my doctor and I estimated that because I took that extra pill, it got up to 0.6. What it was before was well under that. So it was under the therapeutic limit. I was at 0.5 or less, and somewhere between 0.4 and 5. And that was in a danger zone. I was at risk for a manic episode. And thankfully, we caught it in time. I got help in time, and I got that medication. So my doctor authorized some extra medication for me to take, and then I went and saw her in that visit. Now that visit went very interestingly. I talked to her, and I basically discussed, hey, I'm doing something a little differently. I'm going to the gym 6 days a week, and I'm sweating at least a pound. I know based on when I weigh myself before I work out, and then I weigh myself after, that I'm sweating at least a pound to 2 pounds in each workout, and I'm consuming that much and more in water to replenish my hydration afterwards. And so the cumulative effect of working out 6 days a week is, well, that's an extra 2 gallons, That's an extra 2 gallons of water, and I have to saturate that with lithium. And so the effect of all of that, through my kidneys, as it's also flushing, your kidneys are flushing lithium through every day. And so the effect of that is I needed to take more medication. And so we tried taking more medication. Then I got tested 2 weeks later, and that came out high. I was at 0.8. Okay, so this is too high. This is too much. So then we dialed it back. And then I was back at 0.6. Okay, 2 weeks later, getting tested, and I'm back at 0.6. So the two dosages were 1,050 milligrams, and the other dosage was 1,200. So between 1,200 and 1,050 milligrams, my dosage is in between that. But the thing is, there isn't a dosage in between, because lithium only comes in 300 milligram tablets and 450 milligram tablets. So I asked her, can I alternate every day? Can I just take this one day and then this the next, and then keep going back and forth? Because obviously the data shows that my dosage is in between. And she agreed. And I have been taking that ever since. And so for the last year and a half, I've been taking in this pill planner, 1,050, then the next day 1,200, 1,050, 1,200, and you get the picture. Also, I couldn't have kept track without a pill planner, so I highly recommend that you get one if you have bipolar disorder. Without this is what it looks like. You got your medication here, and you pop one in your mouth, and then you go, did I take it? Imagine like if you just woke up and you just had breakfast, and you're really groggy, and you just do this without thinking, and then you go, did I take it? Lithium is not one of those medications that you want to wonder, did I take it? Because if you want to avoid a manic episode, if you want to avoid going low, or if you want to avoid, on the other end, overcompensating by taking an extra when really you shouldn't, when you're at such a high dosage, taking an extra is going to make you toxic. And toxicity involves vomiting and, diarrhea and the whole 9 yards, and including some seizure-like symptoms. So you don't want to overdose either. So to have a pill planner, if you take it and then wonder, did I take it? Here's what you do. You just look at it. You go, yeah, I took it. So I highly recommend that you get that. There's a lot more to my story with lithium and all that. There is a time when, there's a time in the last 3 years when, my first psychiatrist, he actually passed away. And in the transition, and I got another psychiatrist, and he was really bad, that I kind of became, a bit of a renegade, and I didn't take my medication. And so that's a story that I'm going to talk about in a future episode. But for now, I just want to emphasize the importance of getting your medication dialed in. And as difficult as it is, if you can talk with your doctor, if you can persuade your doctor into, doing all of the right things to getting it dialed in exactly, like my lithium level now is 0.7, and it has been for the last 6 months to a year, since I started, getting this really nailed in. And that is just, my doctors see that and they go, this is miraculous. This is ideal. You never get this. But we got it. I got it because I was determined to figure it out. You can do that too. You just have to do everything right. Take whatever medication is prescribed for a week to 2 weeks, and then get tested and do the testing properly. You know, if you're supposed to fast for 12 hours, fast for 12 hours. Just do it, you know, because the end product is your doctor is going to have more respect for you, and you're going to have more respect for yourself and the process if you do it this way. And that's going to make your life a whole lot better. So, you know, it's been a very good experience, you know, doing it that way, and I'm very happy to have my medication, you know, at this great level. Finally, that one thing that seemed to help with my digestive problems, well, I just figured it out in the last 2 weeks, and it's basically fruit pectin. Fruit pectin, it's something that is used to make jellies. You know, you go to the store and you get, you know, grape jelly or strawberry jelly or plum jelly, and well, that's made with fruit pectin. And apples have a lot of fruit pectin. I tried eating apples for 3 days, but I got kind of tired of eating apples. So they sell boxes of fruit pectin for making jellies and jams at home. And you just buy the fruit pectin. It's in the baking aisle. It's next to the, you know, the generic gelatin, you know, and all of that. Craft brand seems to be pretty good. So I have that, and I gotta say, a half a teaspoon per meal mixed in with a little water, it makes all the difference. I am like 100%, like everything feels better. My gut all the way through just feels like it did before I started taking lithium, and I can't recommend it highly enough as well. There are a lot of things I'm recommending. A pill planner. 2, getting your lithium dosage figured out, and also pectin. If you take lithium, pectin's going to really help you. Or honestly, there are a lot of medications that cause digestive trouble. So like if you take other medications that cause you that, fruit pectin really is going to help. Check it out, and check out my next video. Thanks for watching so far. My name is Brian again, and I have bipolar disorder, and this is what I had to talk about today. Thank you.